Hello, everyone. My name is Jatori Shamel. I'm a psychology major. Today, I'm here to talk about clinical psychology. My career goal is to become a clinical psychologist and have my own practice. My interest lies in helping people who have issue with abuse, trauma, or feelings of depression. Clinical psychology is an integration of science, theory, and clinical knowledge for understanding, preventing, and relieving psychological-based distress or dysfunction and to promote subjective well-being and personal development. Another interest of psychology that has my interest is educational psychology. As an educational psychologist, it's possible to teach different learning techniques to adults and children through different organizations that they join. The path of becoming a psychologist usually begins with a bachelor's degree in psychology, where students learn the fundamentals, such as in Dillard University, where right now we are learning to get our bachelor's and to learn the very fundamentals of psychology. You must then obtain a graduate's degree, while some graduate programs accept applicants with an undergraduate degree in other disciplines. Most encourage students to get a bachelor's degree in psychology. Each graduate program determines its entrance requirements. Some doctoral programs require applicants to have a master's degree in psychology. Some students enroll in programs that culminate in master's degrees, planning them to enroll in doctoral programs either immediately upon completion or after a few years of work. Others internal doctoral programs with only a bachelor's degree and work directly on a doctorate. And working in psychology with a master's degree is usually supervised by someone with a doctoral degree. In most states, the independent practice of psychology requires a doctoral degree and a state license. Most doctoral degrees take 5 to 7 years to complete. Some institutions require their students to complete their doctoral studies within 10 years of admission to the institution. Also, you must pass a comprehensive exam and write a defend dissertation. You want to practice psychology and clinical counseling or school psychology, you will also have to complete a 1 year internship as part of your doctoral study in your area of practice. Some universities and professional schools offer a PsyD degree in place of traditional research PhD or the EDD degree. PsyD degrees, with their emphasis on clinical psychology, also are designed for students who want to do clinical work. Entering the educational psychology field requires a rigorous education. Though all students interested in becoming educational psychologists start with a bachelor's degree, a master's degree is a minimum requirement for a career in the field. You may need to earn a PhD if you aspire to teach or research at the university level. All candidates should pursue internships for practical learning opportunities. There are two mandatory exams to pass to obtain licensure in psychology: the examination for professional practice in psychology, aka the EPP, and the jurisprudence examination. The jurisprudence examination costs $243, while the EPP costs $600. You must pass both exams to be considered for a licensure in Texas. Note: school psychologists must pass the National School of Psychology examination rather than the EPP. In Texas, before you can be licensed psychologist, you must apply to be a provisional licensed psychologist. Provisional licensed psychologists must practice under the supervision of psychologists. So during this time, you complete the supervised professional experience required by the board to become a full psychologist. The application is $340 plus a one-time fee of $75 to use Plus, and you will need to submit two passport photos, official transcripts, and a criminal history record check along with your application. To obtain licensure in Texas, you must first complete at least 3,500 work hours in supervised internship settings. Half of these hours, aka 1,750, can be completed as part of a formal internship while earning your doctorate, while at least the other half must be completed after you've obtained your doctoral degree. This training is called a supervised professional experience, aka the SPE. It usually takes 2 years to complete this experience. If you work full time, no school psychology in Texas must complete a formal internship of 1,200 hours or more, and 600 of those must be in a public school. Their salary, according to the Bureau of Labor Statistics, psychologists in Texas, clinical counseling, and school psychologists earn an average of 80,000 to more than $80,000 per year, while post-secondary psychologist teachers earn an average of $74,000 per year. In terms of number of psychologists in the state, there are 6,250 clinical counseling and school psychologists, 3,190 post-secondary psychology teachers, and 670 in the all other psychology category. No employment projections are available for the state of Texas, but nationwide positive growth is expected in all psychology jobs, with the fast growth over the 10-year between 2006 and 2026. Uh, the practice of psychology I'm trying to go through is to create my own program where dogs can be used as a potential benefit of animal assisted therapy on health. The research study 70s, there has been a research study where they studied 76 hospital heart failure patients and their reactions to a visit from either a human volunteer and a dog team, or a human volunteer only or no visit, the at rest group, basically. Patients were randomly assigned to one of these three approaches. We looked at the dog's effects on the variables that characterize heart failure, including the change in cardiac function, neuroendocrine, stress hormone, aka the activation, and psychological changes in mood. The intervention lasted 12 minutes in the volunteer dog team group. Specially trained dogs of 12 different breeds would lie on patients' beds so patients could touch them while interacting with the volunteer dog. The volunteer dog team group showed more improvement than the volunteer only group in heart rate and right arterial pressure and norepinephrine level. My apologies. The study demonstrates that even a short-term exposure to dogs has beneficial psychological and psychosocial effects on patients who want it. This therapy warrants serious consideration and adjunction to medical therapy in hospitalized heart failure patients. Dogs are of great comfort. They make people happier, calmer, and feel more loved. This is a huge when you are scared and not feeling well. The program will be used to increase the patient's agreeableness and openness while decreasing neuroticism by using animals as a support animal for the program. Animals have the effects of normalizing heart rate and blood pressure and reducing pain, reducing stress, and reducing depression and increasing pleasure. By having the animal come in at random using a variable ratio, using this method is with the hope that the patient will be more inclined to speak with the psychologist about their problems with or without the support animal around. Clients who have mild signs of depression or suicidal thoughts are already on guard around psychologists. While the one-on-one process is effective and the process would take longer for clients to open up about their problems by using animals, the same effect may occur, but relatively quicker. The best way to record the data would be first to make an entry of when the client comes in, another when the support animal comes in, and another when it takes it away. When it's taken away. The entry should be made as soon as possible after the event to be documented. This way, the data can be compared to past evaluations. This way, it can be shown how compliant or non-compliant the patient is with or without the animal. The conditioning element being the support animal, how the effect of having the animal around the patient causing an increase in openness. That is my presentation for the day. I hope that everyone has a blessed day and namaste.